name is Henry Silverman, and I would like to give a short presentation regarding waiver of informed consent. What are the criteria? This slide shows the learning objectives for this presentation. By the end of this module, the learner will be able to describe the criteria for waiving informed consent in limited contact research and also for research that is conducted in the emergency setting, explain the many different meanings of the term practicableness, explain the meaning of consent bias, and analyze the balancing of utilitarian concerns against respect for persons. Obtaining informed consent from research participants prior to their participation in research is a cornerstone for the ethical conduct of research. The principle of respect for persons provides the moral justification for informed consent. That said, one might ask, are there types of research we can do ethically without obtaining subjects' consent? The reason to ask this question is that valuable research can be done that would be difficult or impossible to conduct if consent was required. One can justify a waiver of consent if we use a utilitarian framework that balances two competing interests. One interest is the advancement of science to enhance population health. And the other interest we have in research is the protection of the welfare and rights of subjects. That said, there might be instances in which the benefits that one could obtain from research are great enough to override an interest in subject welfare and rights. And that is because such research presents minimal risk to the subjects, and the subjects may have, in certain types of research, a limited autonomy interest. Before explaining more about this utilitarian framework, let's look at what the regulations say about waiver of informed consent. The Nuremberg Code, developed in 1947 from the proceedings of the Nazi doctors' trial, had as its first principle, the voluntary consent of the human subject is absolutely essential. The Declaration of Helsinki, first published in 1964, was developed in part to address issues not covered by the Nuremberg Code, such as research involving special populations. The Declaration states that research may be done involving individuals from whom it is not possible to obtain consent only if the condition that prevents obtaining consent is a necessary characteristic of the research population. In other words, you can involve incompetent patients in research only when the study is investigating the illness that the incompetent patient has. Recognizing that important research is needed to advance the health of groups who cannot give their own consent, Helsinki gave the opinion that research with vulnerable subjects, for example, the mentally impaired and children, may be done with less than full consent through the vehicle of surrogate consent. The Helsinki document realized that research participants can still be adequately protected in the absence of consent, thus allowing important research to proceed. Now, although Helsinki recognized the value of surrogate consent, what about a waiver of consent? When we discuss a waiver of consent, regulations, including the U.S. regulations, recognize a waiver in three different types of instances. One, we have a waiver of the documentation of informed consent. Second, we have waivers that are ethically appropriate in limited contact research or minimal risk research. These include archivals and record research and observational research in large groups. And the final use of the word waiver refers to research performed in the emergency setting. In this instance, potential subjects are not competent to give consent at the time of the intervention, and there is no opportunity to obtain surrogate consent due to the narrow time window for the administration of the intervention. The first two types of waiver is recognized in the common rule, specifically the waiver of the documentation of informed consent and the waiver of the informed consent itself, either when it does not include or which alters some or all of the elements of the informed consent, or weighs the requirements to obtain the informed consent itself. Regarding the waiver of the documentation of informed consent, full consent is given, but there is no signature, either because the research presents no more than minimal risk and involves normal clinical procedures, or the written signature would be the only way to identify the participant, and not having the written signature would enhance protection for the participants. Examples of a waiver, examples whereby a waiver of documentation of consent would be appropriate, would involve research involving telephone surveys or internet surveys. Documentation can also be waived for cultural reasons, whereby participants might be wary of signing documents for fear that there might be repercussions from signing such documents. Finally, research that includes certain groups in which there might be legal repercussions from a breach of confidentiality and hence not requiring a signature would enhance their protection. Regarding waiver requirements for limited contact research, the common rule states that an IRB may approve a consent procedure which does not include or which alters some or all of the elements of informed consent, or waive the requirement to obtain informed consent, provided the IRB finds and documents the following criteria. 1, the research involves no more than minimal risk to the subjects. 2, the waiver or alteration will not adversely affect the rights and welfare of the subjects. 3, the research could not practicably be carried out without the waiver or the alteration. And 4, whenever appropriate, the subjects will be provided with additional pertinent information after participation. Now, there are several important key words in these criteria. 1 is the definition of minimal risk. 2, what do we mean by the waiver will not adversely affect the rights of the subjects? 3, when could research not be practicably carried out? And 4, what do we mean by whenever appropriate? Well, this next slide shows the standard definition of minimal risk. The probability and magnitude of harm or discomfort anticipated in the research are not greater than the risk ordinarily encountered in the daily life or during routine performance of physical and psychological examinations or tests. To be sure, there has been much controversy regarding this definition, an issue that we will explore in a future webinar. I would, however, like to spend some time on this concept of practicableness. Obtaining informed consent can be impracticable for 2 major reasons. 1, logistical issues, and 2, methodological or scientific reasons. Logistical reasons would include situations in which it would not be practicable to obtain informed consent because one is not able to locate the previous subjects, either because there are inaccurate contact information or many of the subjects have already died. This occurs in retrospective research. Regarding methodological reasons, this involves issues that will threaten the scientific validity of the research. In other words, requiring informed consent would decrease the scientific validity of the research. For example, one may need a complete sample size for epidemiologic studies to establish true prevalence rates in the community, or there may be consent bias when certain groups are left out. Consent bias represents a type of selection bias and is said to exist when the group giving researchers access to their data differs from the group refusing access, and thus any conclusion derived from the research will not be generalizable to the whole population. Well, we've gone over minimal risk and the concept of practicableness. What about this concept of research or the waiver not adversely affecting the rights of the subjects? Well, this refers to the concept that in certain situations, not obtaining consent might represent a negligible infringement on someone's rights. For example, one might be able to assume that most people might be comfortable with not having their informed consent in observational research that is performed in public settings. Finally, the last criteria, whenever appropriate, usually the IRB, in conjunction with the investigators, would decide when it might be appropriate to tell subjects additional pertinent information after participation. Examples of when a full waiver might be granted involves types of retrospective record research, where, as we have discussed before, it is not practicable to locate the subjects, or in certain types of research in which the researchers de-identifies the data. A full waiver may be justifiable in epidemiologic studies where a complete sample size is required for accurate prevalence rates, observational research on large groups, and then, as we discussed before, a waiver might be appropriate where obtaining informed consent may not be practicable for either logistical reasons or methodological reasons. In addition to approving a full waiver, an IRB may approve the elimination or alteration of one or more of the 8 required elements of informed consent, as shown in this slide. Usually, this occurs in certain types of deception research. Our third and final type of waiver refers to what is known as an exception from informed consent requirements in emergency research, and both the FDA and the Department of Health and Human Services have criteria for such type of waivers, which are essentially similar. And the criteria are shown in the next few slides. 1, patients have to be in a life-threatening situation. Current therapy is unsatisfactory or unproven. Obtaining informed consent from the participant or legally authorized representative is not feasible, and the proposed intervention holds the prospect of direct benefit to the participants, usually based on previous scientific studies. Other criteria involves obtaining consent from the participants or proxy should be obtained when possible. There should be respect for proxy or participant assent or dissent after enrollment. And then there are additional protections such as community consultation, public disclosure prior to study initiation and after study completion, and the presence of an independent data monitoring committee. In regards to community consultation, the regulations states consultation, including where appropriate, consultation carried out by the IRB with representatives of the communities in which the research will be conducted and from which the subjects will be drawn. However, to be sure, in many instances, it may be difficult to delineate exactly the geographical boundaries of the community or which groups actually comprise the community. Examples of a waiver of informed consent in the emergency setting includes research that investigates new techniques to resuscitate from a cardiac arrest, new blood transfusion products for severely injured patients, and new therapies for strokes. And to be complete, an IRB may waive the requirement for obtaining parental or guardian permission in certain types of studies. This occurs when the research protocol is designed to study conditions in children for which parental or guardian permission is not a reasonable requirement to protect the subjects. Examples include studies that involve neglected or abused children, or survey studies involving questions about illegal or socially concerning behaviors of adolescents. So in summary, in particular situations, the IRB may approve the waiver of informed consent. This could involve either the waiver of the documentation of consent or the waiver of some or all of the elements of informed consent. Ethical requirements include that the study be minimal risk and that the study is not feasible without the waiver, and subject rights and welfare are protected. And then finally, we have research in the emergency setting. Thank you very much.